I'll let you know once I think we're on. Okay. Yeah, I think that should be us live now. So hi everyone, good morning, and thank you for joining us. If you're joining us live or if you're watching on demand a little bit later, then we're really happy to have you here. And as you can see, we've got some academics here from the Clinical Pharmacology program at the University of Glasgow to talk you through what you can expect if and hopefully when you join us. So just as a little bit of housekeeping, if you have registered with us to watch this webinar and you submitted a question, then I will have it here on my sheet and I will be asking questions on your behalf. But of course, throughout the session, if you have any other questions that come to you, then you should be able to access a Q&A box on the bottom of your screen. And we're here for you for the next half hour, so feel free to get your questions in and we'll also get to those in session as well. If we run out of time, then you are welcome to email me. I'm Sarah McQueen. I'm the person who sent you the original registration email, and I will forward it on to the relevant person. Or you can also contact your admin. And I'm just going to quickly drop the email address details in the chat. Here we go. So you can see it's mbls-clinpharm@glasgow.ac.uk, and that will also get to the right person if you've got questions that we don't quite get onto. Okay, so I guess we'll start then with some introductions. So if I could maybe go to Professor Jessie Dawson, do you want to do a little intro?
Yeah, hi, good morning for me at least it is. My name is Jess Dawson. I'm a clinical
pharm. A little freeze, have I frozen?
Oh, I seem to be okay.
Yeah, I think you're okay, Sarah. I think it's yourself.
Okay, well, I'll carry on. I'm Jess Dawson. I'm a clinical pharmacologist by background, but now mostly work in stroke and stroke research and cardiovascular prevention. But I've been involved with the MSc program for probably the past maybe 5 or 6 years. And this year has obviously been an interesting year, but the one positive thing to say is we've made a lot of changes to our course materials, and I'm actually really looking forward to this year because there's a kind of new structure to how we're going to deliver things and some new content, and there's been lots of new things in terms of new treatments and things over the past couple of years. So very much looking forward to to working with you all, hopefully as of a few weeks' time. So over to you, Willie.
Again, so good morning, everyone, or good afternoon, or indeed good evening if you're watching this later. So my name's William Miller. I'm a senior lecturer in the School of Medicine, Dentistry and Nursing at Glasgow. And I, along with Jess, I'm one of the co-directors of the programme, so you'll have seen quite a bit of information coming out with both of our names on it, I guess, over the last few months. Again, we're looking really forward to this year. It has been challenging to get to this point. But we're quite excited to see how things go. I think a lot of changes had to be put in place rapidly last year, but one of the good things is that we've all had an opportunity now to sort of digest and reflect on those. And I think it's quite interesting that in life you can either have challenges or opportunities, and I think we've viewed this as being an opportunity to review the programme, review how we deliver things. And there's things that we just simply won't go back to. I think the days of having lots of students sitting in exam halls, writing big long exams and so on, probably won't happen again, and we'll move to a far more online format for things like that. My background is I'm a basic scientist. Don't really like that term, but that's what people say. My background is in biochemistry and pharmacology, and coincidentally, my academic research career started off in hemorrhagic stroke. So you've got 2 stroke guys here, although I absolutely defer to Jessie's expertise in that area. So I guess in terms of the day-to-day running, my background now really, or my current area is that I'm more involved in the teaching side of things. So I'm not really directly involved in a huge amount of scientific or clinical research, although I do keep some bits and pieces ticking over. But the main focus of my job, if you like, is to ensure that the MSc in Clinical Pharmacology and 1 or 2 other areas are running smoothly, up to date, organised and so on. So I'll be really pleased to help you with any of the questions that you've got today, And again, I'm really pleased to see you once you're with us in Glasgow. So maybe hand back to Sarah just now, and she can get us running with the questions.
Will do. I think I had a little internet blip there. I don't know if it affected everyone. I've somehow taken down the whole Zoom, but hopefully it'll manage to keep going for the rest of the session. So we'll just dive in then and have a look at the submitted questions. But like I said, if anything else comes up, please do use the Q&A box at the bottom to submit anything else. So I'm going to start with questions about registration and enrollment. We were hoping to have an administrator join us today to talk about some of these things, but I think having spoken to some of the admin recently, I should be able to answer some of these. So if you are looking to register and enroll, it looks like a lot of you are having difficulty with adding optional classes, with enrolling, or you've got something like a conflict of schedule. I am aware that there's been quite a few issues with this, unfortunately, just because we're moving everything back 2 months. So we're having to change everything on my campus to reflect that, and it's taking a little while, basically. I think, generally speaking, this is all getting fixed on a daily, almost hourly basis. So if you are still having an issue and it's not letting you enroll, it's not letting you register, definitely do get in touch with your administrator. So the way to do that is to email the address which is in the chat at the moment, mvls-clinpharm@glasgow.ac.uk. If you're not sure how to find that in the chat, you can also go to the Clinical Pharmacology webpage on the University of Glasgow website. Right at the top, there's a blue box which will have an administrative email address in there, and that's the same as the one that's in the chat just now. So definitely send in an email, let them know which courses, potentially the course code and the name that you can enroll on, and they will be able to fix that for you. So I think hopefully that will answer that, but is there anything else you wanted to add, Willie or Jessie, before we move on to more sort of teaching questions? Yeah, Willie?
Perhaps I could add a little bit. The general structure of the programme is that there's 180 credits across the year, and 120 of those credits are taught credits, so scheduled classes and so on, with the other 60 credits coming from your project. From those 120 credits, 110 of them will be in common for everyone during this year, and you will have the option of selecting a specific 10 credit option towards the end of semester 2. So just to reiterate what Sarah was saying, we're aware that there's some issues just now. It's just a little bit of computer glitchy stuff because we've moved things around a little bit. What I want to really emphasize is please don't worry about it. We can and will get this fixed. So I understand that as someone who's new to the university, you're very keen to have everything set out in advance and have a very, very clear plan. And that absolutely is our intention for you. But if you are running into issues with this, please don't worry. There's nothing that's happening here that I've seen in the list of questions that isn't fixable. Even if the system says it isn't fixable, it is fixable. We'll make sure that it gets fixed for you. So hang in there. Make sure, as Sarah says, that the admin team are aware, and we'll get things sorted out for you. But in terms of options, please don't worry about that until semester 2. And once we get to meet with you, we'll update you on how that process works.
Well, thank you very much. I can see you've had a question in quickly, which is about Chevening Scholarship to submit an offer about, so basically it's a scholarship question. It's about getting certification through. Again, I think this is quite a specific issue. And I think you would definitely be worth emailing the admin if you haven't already. If you have already emailed the admin and they haven't heard back, can you shoot me an email? So sarah.mcqueen@glasgow.ac.uk, and I will forward it to the right person or make sure that they're aware of it if it is a time sensitive thing. And you can email me just by hitting respond on the registration link that I sent you initially as well. And I think Willie's just dropped an extra link in there specifically about that scholarship. Okay, so let's have a look. We've had a lot of teaching questions, understandably, because I can see why you would have a lot of questions about this. I'm just going to see what the best way to order this would be. Shall we jump in and talk about the practical classes and labs? Do you want to say something about that? Who wants to go first?
Do you want to start on that, Willie? Because I guess they're more the sub-courses that you're involved in, aren't they?
Sure. So in terms of laboratories, there will be, I guess, three main routes by which you'll have laboratory, or we're hoping you'll have laboratory exposure during the year. The main part of your laboratory and practical experience for all students, if you want to have laboratory experience, would be from your project, okay? So that's where you spend your summer, hopefully in a socially distant environment and so on, working in a laboratory alongside our researchers, and that's where you would really gain the maximum amount of practical skills. So that's the first thing, and that obviously we don't really have a crystal ball at this stage to know how that's going to work, but our intention is that we hope to be able to offer laboratory projects in the summer. There are two other areas in which you've got potential exposure to laboratories. One is one of the optional 10 credit courses that I referred to a moment ago, which would happen towards the end of semester 2. And as things stand just now, we're aiming for that to happen face to face. The same course ran at the end of last year, and unfortunately due to the circumstances at the time, the team had to pivot that round into an online delivery, which actually worked pretty well. But our intention is, it doesn't really fully replace hands-on experience. So our intention is that for this year, that will be a hands-on laboratory. And then the final part is something that you will all do as clinical pharmacology students. There is a short laboratory session embedded within one of the courses that I run, which is called Principles of Pharmacology, which runs across the first semester and into semester 2. That laboratory session usually takes place in very small groups anyway. As things stand right now, we're keen to offer that face-to-face, but we understand that some of you may not be able to or may not want to be in Glasgow until perhaps January. If that's the case, we will either look at the scheduling to try and fit you in a little bit later, or we will make sure there's an equivalent online version of it that you can get involved with. I think I'll maybe throw something else in that may or may not be of interest to you. We've recently been involved with some discussions with the pharmaceutical industry, and they're looking at sending some of their students to undertake an apprenticeship, a master's level apprenticeship. And what's been interesting as part of that dialogue is that the people that are working in industry actually see the clinical pharmacologists that they employ as being people who perhaps might not really be based in laboratories. They're more likely to be office-based, organising clinical trials, collating the data, analysing the data, working as part of a multidisciplinary team. So we absolutely will make sure that we've got laboratory experience available for you, subject to the various changes that may happen due to COVID and so on. But at the same time, I want to get across that it's maybe not the be-all and end-all of your year doing an MSc in clinical pharmacology. You will learn lots of stuff this year.
Absolutely.
I think that's all I want to say about that just now. I don't know if you've got anything to add, Jess.
No, I mean, I would certainly echo the final point that, clinical pharmacology today is not clinical pharmacology from 20 years ago. It's very, very different, and with access to big data and things like GWAS and pharmacogenomic information that's available en masse, it certainly is a very different skill set. And I think that's what we have tried to reflect in the course restructuring, is to obviously have lab components available, and they are of course still relevant, but also make sure that some of the more modern things around critical appraisal, pharmacogenomics and all those things are well covered.
Perfect, thank you. And we did have questions involved in there, which was about will everything be online in semester 1? Will it be in semester 2? And I wondered if you had anything else to add about the sort of timings and what will be happening in semester 1 versus semester 2.
So the way that the program's structured is there's a sort of chronological order to our courses. We start with some of the basic pharmacology, unashamedly revision for some of you, because we get quite a disparate group of students who come onto this program, and it may be a while since some of you have done any pharmacology. It may be some of you have been working for a number of years. It may be that some of you have come from slightly different backgrounds. So we start off with the basic pharmacology. We move through the more advanced and clinical pharmacology as the semester progresses and as the year progresses. So that sort of dictates the order in which we deliver things. The current plan for semester 1 is that the majority of the large group lectures and seminars will be delivered in an online format. But we will still be looking to try and see where there are opportunities for some face-to-face students, so face-to-face delivery, face-to-face activities for students who are in and around Glasgow during the first semester. And the planning is still ongoing for semester 2. It's probably likely to be fairly similar. So we're going to have a blended approach where the large stuff will happen predominantly online, and we hope to have opportunities for small group face-to-face activities. But we do obviously recognise that for some students, travelling may be an issue. You may have shielding issues or health concerns and so on. And however we go about things, we will make sure that we cater for everyone, no matter how they're engaging with the programme.
Yeah. And I think just to add that the important thing, and I think that, the key factor for you guys to consider as potential students is we will be able to deliver all the learning outcomes. And I think we're very confident on that, and our experiences of what we had to put in very short notice in February and March make us confident of that. So I think, educationally, you will still have a good experience. And I think that's, the most important thing. We obviously want that to involve as much group learning and things as it possibly can.
Okay, thank you. Sorry, I know I look distracted. I'm typing answers to some of the queries coming in at the same time.
Are there chat queries as well? Let me have a look.
No, I think we're fine. I think we're just
Okay.
about up to date. I can see we've had a question here, which is about assisting in enrollment, council tax exemption, and self-isolation. So all quite practical things. I'm about to pop a message in as well, but I would probably say for enrollment, email the administrator. For council tax exemption, I've got a link I'm going to send you, but student services should be able to help with that. It is, from what I remember, it's a fairly simple form that you apply to via Glasgow City Council. And travelling from Nigeria to the UK for self-isolation, I think I might have to, again, it's one of those things that's changing almost on a daily basis. I would probably just be referring to the Scottish Government guidelines for that. But I'm going to try and find a link just now and send it to you in the Q&A as well. I think that's everything that's just been posted in here. So we'll go back now to the questions that were submitted. Sorry if you've already covered this, but we did have a couple of questions which were about when will when will everything end, basically, because we know that a lot of PhDs, jobs, things like that, graduate schemes typically would start in September, but obviously with us starting in November, it's pushing everything a little bit back, so that's causing a bit of concern. Would you have anything to say about the timings for things? Willie looks like he's ready to jump in.
Yeah, I'm primed and keen to respond. So the official end date for the academic year for our MSc Clinical Pharmacology cohort is due to be Monday, the 11th of October in 2021. I'm getting my years mixed up. I'm very easily confused.
Yeah.
Monday, the 11th of October. Now, we do fully appreciate that the start of October is usually one of the main periods where students start PhD placements. I think it's fair to say that by the time you get towards the end of September and into October, your dissertation projects should be at quite an advanced stage. And we kind of allow students, postgraduate is a bit different to undergraduate. Your adults, we allow you to work to your own sort of workloads. We do have deadlines, we do have schedules, but I think whilst you're doing your project, it's something that you're meant to be doing sort of independently. So if you're in a position where you know you have a PhD place starting at the start of October and you want to work a little bit harder and work alongside your supervisor to be able to get finished earlier, that's absolutely fine. The deadline is the last date, it's not the earliest date, if you see what I mean. So I would encourage you throughout the year actually to work towards your workload rather than work towards deadlines, if that makes sense. If things become a bit more complicated than that, then we would be quite happy to contact the host institution of where you're moving to next to explain things and to try and come up with a solution that works for everyone. So we don't, to be really, really clear, we recognise that the slightly longer deadline for the programme may potentially cause some issues, but we don't want them to cause issues, and we will work with you and your PhD supervisor or your employer or your government sponsor or whoever else is involved to try and come to some sort of arrangement that everyone's happy with. And to be honest, this is something that happens in a normal year anyway. You know, we've had, for example, a student who was starting a medical degree in the United States at the end of August in a normal year, and we were able to make things work. So please try not to worry too much about that. That said, it's good to give us advance notice. You know, it's always good, particularly when we start thinking about your dissertation, to let us know that you're a bit worried about or have some concerns about the deadlines.
Okay.
Yeah, absolutely.
Perfect. So, another question's just popped in. When will semester 1 end?
Okay.
Do you have that to hand?
Yes, I do. So the official end of semester 1 is Friday the 26th of February, and that's when the examination period for semester 1 will end. The end of teaching for semester 1 is Friday the 12th of February. So you can see that there's a 2-week period from the end of teaching and then into the examination period. So hopefully that answers that for you.
Okay, and actually bringing us on then to examinations, we did have a question which was, are there going to be midterm examinations? If so, will they be online?
Okay, so I think the first thing is that as things stand right now, our plans are that any assessments that we deliver this year will be online. There are no current plans to deliver assessments in an exam hall setting or anything like that. In terms of midterm exams, we don't really have those as such. But what I can maybe do is briefly explain how we currently assess the programme, and then I'll maybe give you an idea of how we're maybe thinking about changing it a little bit. We deliberately make most of the summative assessments, so the assessments that count towards your final grade, your final degree outcome, we usually have them at the end of the year, at the end of semester 2. We tend not to have too many summative assessments at the end of semester 1. That's because experience has shown us that if we do that, some students are still getting used to life in Glasgow, getting used to studying at postgraduate level, and so on and so forth. And if we offer summative assessments at the end of semester 1, occasionally some students might find those more challenging than they should be, not because they're not academically up to it, but because they're just getting to grips with life, okay? So we deliberately weight most of our final assessments towards the end of semester 2. However, what we do at the end of semester 1 is offer some formative assessments. So these don't count towards your final grade, but what they do is give you the experience of how we're going to assess you, and it allows you to benchmark your own performance, and it allows us to give you feedback on where you are as well. So there won't be anything in terms of assessment of any real weight until towards the end of semester 1.
Okay, thank you. And just finishing up then on the teaching questions, someone asked, do classes happen at Queen Elizabeth University Hospital? So maybe just a quick word on teaching locations, if/when/hopefully we can actually get into labs or into classrooms, etc.
So I'm sure Jess will be able to add a bit more than this, but my understanding is there are good things and bad things that have come out of the COVID situation. One of the good things is that our College of Medical Veterinary and Life Sciences has played a leading role in a lot of areas, but one of the areas we've been particularly involved in is the testing of patient samples for COVID-19. The downside of that is that it meant we had to build a testing centre from scratch, and the place that we ended up using for that was the laboratories in the Teaching and Learning Centre. They were prioritised as being a space where we could carry out this massive testing initiative. So for the foreseeable future, the site that we would normally use at the Queen Elizabeth Hospital won't be used for teaching as such. There are then two things. The first thing is that, as I've already said, most of our large group sessions, our lectures, our seminars and so on will happen online. If we do have face-to-face teaching, that will happen on the main campus in Gilmore Hill, where the main university building is. I'm guessing that part of your question may have been to do with accommodation. So if you're coming to Glasgow, I would suggest that for this year, then it probably makes sense to try and base yourself nearer the main university campus than Queen Elizabeth Hospital. Yeah,
that advice would apply any year anyway. But yeah, absolutely.
Perfect. Okay. I'm thinking that we will maybe try and fit in some project and internship questions. So we had a question which was, how are dissertation topics determined?
Okay, so basically what we do is every year we put out a call across the college. So we get a wide range of potential topics from right across the College of Medical, Veterinary and Life Sciences. And our colleagues who are running research programs in the various research institutes, if they can accommodate an MSc student, will send us some details of a project. Okay, so we end up with a list of projects. We have a list of students. We will look at potentially your academic performance over the year, including your formative assessments as well, just to give us an idea of your sort of ranking. And where we have a situation where particular projects are very popular with students, then we'll use your academic rank to assign you to projects. But generally speaking, in the past few years when we've been through this process, most students have had their first or second choice of the project. The other thing I should say is that we are occasionally open to students proposing their own projects. If there's an area that you're very, very interested in, that you've got an idea that makes sense for a project, and if we can find someone who is suitably qualified and interested and has the capacity to take you on as a student, then we will try and make that happen for you as well. I don't know if Jess wants to add anything about the projects.
No, I mean, I think that, again, the key thing, just to reassure you, is that, you know, as Willie said, our goal is to give you a project that is of interest to you and that suits the skills that you want to acquire. There are obviously some limitations in the current climate as to, you know, the range of things, but topic-wise, you know, absolutely, we want you to do a project that suits you. And, you know, we'll have discussions with you throughout the year to try and facilitate that. So again, I'm sure we can find a satisfactory solution.
To maybe add one tiny point, just to give you an idea of things, we traditionally, and as Jess has just alluded to, things might be a bit different in the current climate. Traditionally, we have 3 or 4 distinct types of projects. We usually are able to offer laboratory projects, and that does what it says in the tin. It's a laboratory experience. You're working in the research institutes. We also recognise that not everyone wants to work in a laboratory, so there are opportunities. We can't really let you be directly involved with patients. That's governed by the NHS in the UK and in Scotland, not by the university. But we can give you opportunities to work with clinical data, for example, from ongoing clinical trials, and work alongside clinicians in that sense. And then there are things like clinical audits, looking at, for example, prescribing patterns and so on that some people might be interested in. And then the final thing would be something like an in-depth systematic review of existing data to try and pull out some new novel themes or ideas or areas of that deserve more attention in future studies. And, you know, we have, for example, quite a lot of students who come from areas that are where they're government sponsored. They're maybe going back home to a promoted position, and on a sort of daily or monthly basis, their task might be their boss saying, can you go and find out about all of the new opioid-based analgesics that are currently in development? And so having that skill set to go and look at the literature, make critical judgments of how things are developing, and condense that into a really neat written report is actually a really, really powerful skill to have. So we're capable of delivering all of these, and we've done that successfully for a number of years.
Absolutely.
Okay, thank you. I'm aware that we are coming up to the end of time, not the end of time in general, just for this session, I hope. So if Jess or Willie, if you need to head off ASAP, please just let me know. We do have a couple more questions that we could potentially squeeze in if you don't mind.
Yeah, I think the key thing I think it would be nice to just address, and it will only take a minute anyway, I think the after graduation side of things, William,
definitely.
where a lot of our students end up.
Okay, well, I mean, some of the questions that we had there were things like with clinical or hospital sectors, are there options outside of clinical duties? Are there specific places that clinical pharmacology graduates tend to go to? So if you've got a second to address those things, then that would be great.
I mean, I can talk broadly, maybe when we get to the clinical side of things, Jess might want to pick that up. But generally speaking, we see three main sort of destinations for our students, maybe three or four. One would be that quite a lot of students use their MSc as a platform to go on and study for a PhD. And again, every year we see quite a significant number of our students who do that. Sometimes there are opportunities still available in Glasgow. If you like it here and you want to stay here and you're a good student, then we're very, very keen for you to stay on and continue your graduate studies in Glasgow at PhD. So that's one outcome. Another outcome, as I already mentioned, was that students sometimes are here in a sponsorship and they may return home into promoted positions. A number of students will go and work in the pharmaceutical industry. And again, I've alluded to, we're in quite close dialogue with a lot of the pharmaceutical industry in the UK just now. And then, of course, for our clinically trained colleagues, there are potentially options there working in the health services, either in the UK or again abroad. So I think those are the sort of broad areas. I'm not sure if Jess can expand on any of that.
No, I think that's absolutely it. And we do see a lot of our students, our international students really, I'm specifically referring to returning home to academic positions or to more senior positions than they left with and have all coped very well with that. So I think I don't think there is a specific, singular avenue once you finish the course. It very much can be a stepping stone to industry, to a PhD, or, if you're a pharmacist, to enhance your your pharmacy career, or if you're a clinician, to open up other avenues. So it is very varied. I think we're generally very pleased with how our students get on, and a few years after we hear back from them about what they're doing. Lots of opportunities.
Perfect. Okay. So anything else that you'd like to add to the after graduating section? Or I think maybe just to finish up, we did have questions about preparing for studies, which I thought might be a good place to end with.
So I can maybe pick up a little bit of that latter point. I can see we've got questions about reading lists and course outlines and materials and so on. It sounds as if this is coming from some of you who are perhaps intending to be in Glasgow, or maybe are already in Glasgow and they're having to quarantine and so on. I'm a bit divided here, and I'll explain why. Generally speaking, we don't give out massive reading lists, okay? Postgraduate degrees are a bit different in that what we do in the lectures and the seminars is we give you the skeleton of what you need to know. And the expectation is at postgraduate level, a lot more of your study is self-directed. So we give you the skeleton and your job is to add the meat to the skeleton, okay? So from that perspective, a lot of what you do would be additional reading. Usually we encourage you to read sort of primary research papers and medical papers rather than textbooks or exhaustive lists of reading. So we don't really have reading lists as such. Individual lecturers in their sessions may direct you to things, but the expectation is that you spend quite a bit of your time doing that on your own. So from that perspective, I'm a bit reluctant to sort of say, here's a reading list that you can look at in advance, because I'm not entirely convinced as to how useful it would be. I can see that the Mackay and Walters textbooks been mentioned. By all means, if you want to go and buy a textbook in clinical pharmacology, then please do go and you don't even have to buy it. You can access it electronically from the library. So that would be a good place to start. The second part of it is about what to do whilst you're perhaps in quarantine and you're looking to prepare. My understanding, and apologies because I don't have the information to hand, but we can make it available to you, is that the College of NVLS, is looking to arrange various online courses and activities specifically aimed at students who find themselves in that position where they're already in Glasgow, but the programme hasn't started yet, and they're looking for a few things to do. And some of these activities include things that will enhance your CV, that will help you develop your academic skills and so on, but they're just not clinical pharmacology. And I'm okay with that. I think there's enough time in the programme for you to do your clinical pharmacology. So I would say if you're here already and you're having to put off a bit of time, try and chill out a wee bit, try and recharge your batteries, perhaps get involved with some of the tasks, some of the activities that NBLS are running, and we'll look forward to seeing you on the 9th of November. We don't want to give you lots and lots of stuff to do in advance, so there'll be plenty of time for that. That's kind of my view. I don't know whether Jessie sees it differently, but I think we've got a full programme, so I wouldn't worry about doing too much in advance.
Absolutely, absolutely, and no, I agree, and I think you know, I would use those 2 weeks to familiarise ourselves with general things and just follow what the college give. Absolutely.
Okay. Well, we'll look to finish up quite soon then. If you still have questions then that you don't manage to fit into the Q&A, then please do send them either to me and I will forward them on, or to Nikki, which is the ClinPharm admin email address in the chat. We had one last one, which was just clarifying about exams being online. The student said their internet dropped out. So do you want to say just one more quick thing on that, and then we'll finish up?
So the quick thing is yes.
Yes.
The current plans are that our assessments this year will all take place online. There are no plans to have people sitting in exam halls writing for 3 hours on bits of paper. And we'll probably stay with that. I think that was something we learned from this year, that there are better, more modern ways to assess than perhaps us, and indeed the whole of higher education in the UK has been assessing for hundreds of years. So our current plans are absolutely online.
So I would say if you're still watching and you're having any issues with the internet, then we will be sending you a link so that you can re-watch this, and hopefully that recording will be a little bit clearer to understand. I will get on to doing the transcript as soon as I can, but sometimes it struggles with Scottish accents, so just take it with a pinch of salt, whatever it says. But I think we'd better finish up just now, because we've gone a wee bit over time. I can still see that there's still questions coming in, but I would encourage you to watch this back if it wasn't covered, and if it wasn't covered, then you can get back to me, and I will figure out the answers or send your email on to someone who knows the answers. Okay, in that case, we'll finish up there then. Willie, Jessie, if you got any final bits to add? Maybe just thanks for joining, and we'll see you soon, hopefully.
Yeah, absolutely. Look forward to getting started, indeed.
Absolutely. We're really pleased that so many of you joined us online today. And you know, hopefully what we've given you is some useful information. And as Sarah said, anything else, just please get in touch. There's various ways of doing that, and we'll get back to you as soon as we can. And we'll
all right.
to see you in November.
Yes. Okay. Thank you so much, everyone. Bye for now.
Take care. Bye-bye. Bye. Bye.